Hey guys, so this video is going to be a little different than the rest of my videos, even though they're all unique in their own way. This one is about my client Irene, who for the past 20 years of her life has been stuck in a wheelchair, which sounds like a drag, but it also means you get to have a really cool elevator inside of your house. But in all seriousness, Irene suffers from MS, multiple sclerosis. Now, Irene has gone through both types of MS. She started with relapsing remitting and then progressed to secondary progressive MS. Without getting into all the details, it basically means her brain and spinal cord are almost deteriorating because her immune system is attacking and destroying the protective coverings of her nerves. It basically makes it hard for her brain to tell her body what to do and hard for those signals to get sent. And you suffer from a lot of different symptoms, numbness, you could suffer blindness, paralysis, which Irene has a lot on one side of her body, which is common in MS. And it's a progressive disease. It just gets worse and worse. There's no cure. She still has to take 30 pills a day, at least 30 pills a day, just to have a normal lifestyle. So I've been working with Irene for the past about 3 years, and she'd been going to a physical therapist for years, and I guess she felt he got a little complacent, never really trying anything new, never really advancing in her strength or her stamina. So we started working together. I've worked with many people in the past with certain issues that you don't see every day, and to see what we could do about it. And here we are. Let's talk about the training a little bit. Stretching the hip flexors is one of the most important things we have to do in general in society. But for her, she's stuck in a wheelchair all day. So sitting, the amount of back pain that can cause you, it can get excruciating. So we got to keep the hip flexors loose and stand as much as possible, which is kind of hard when you can't stand. But anyway, yeah, we started working together to see what we could do, and try all sorts of different techniques with her that you don't normally see in training, but still able to apply basic fundamentals of training as far as certain exercises go. So every session we start off by stretching, seeing how the body is that day, because it does change from day to day.
This hand does not behave.
You have good days and you got bad days, but that doesn't mean you can't get better. For every step forward that you take, it seems like the disease takes 2 steps forward, but that doesn't mean you just will stand still or walk in place. Here we are doing some hand exercises, which not only serve as training your muscles, your tendons, your coordination, but also some cognitive training as well. We try everything from live long and prosper to the middle finger. And you can see her left side she has a lot more trouble with than her right. We do both hands together. It's a lot easier for her to visually see her right hand performing the movement, so her left hand can mimic it. If she try to do it alone or with her eyes closed, it can get pretty ugly. Her brain has a really tough time basically just telling the rest of the body what to do. And you can see just the hand gestures of how exhausting it could be for her. Here we are with a couple different finger exercises. Imagine just like tapping each finger on your lap, just as easy as it can be, but you could see how much of a struggle that could be. It's a simple little task. So we move on from stretching to we stretch out the hands and wrists and forearms beforehand, and then we work on our movements and coordination patterns and gestures. Next up, we go into we added in music therapy. Now, there's something to be said about music therapy, and I don't mean like in a drug rehab center and relaxing people if you break down playing the piano, Irene used to be quite proficient at the piano many years ago, probably before I was born. So we dusted the dust off of this one and added this into our training. It not only serves as, actually training those hands again, but the cognitive training and being able to remember certain notes or certain scales. It is and it isn't like riding a bike. If you really break down playing the piano, you got your music center of the brain, then you got the center of the brain that tells your hands what to do and what to play, and then you have to work overtime, making sure you're in the right rhythm and have the right timing, etc., etc.
Are you totally numb or just a few fingers?
So if you really break it down that way, you see how complicated this can be, especially when your brain isn't functioning at the same level as you would without MS. It's harder. The signals are being sent. Some of them miss the bus stop, and sometimes it takes the bus a little bit longer to get to its destination. Sometimes we'll change things up. We'll do scales. The left hand, obviously, you see is tougher, but she has been making some gains with it. We'll try with her eyes closed. So now she has to just go based on what she's hearing. Even though her hand is completely numb, she has to sort of use whatever proprioception she has, which isn't much, to sense where her fingers are going to go, and use the sound of the piano to help guide her along. This game right here, you may recognize if you've ever been to Cracker Barrel. We don't play by the rules. We just simply pull the pins out and put them back in the hole. You've probably seen this done with anyone who suffers any sort of nerve damage to their hand or tendon or ligament tears. For Irene, remember her left hand is completely numb. So we do comparison times. We do 1 or 2 sets, and we time them, and we try to beat our time every time. And again, the disease is progressive, and here's her dog sneaking in on the shot. But the disease is progressive, but she's gotten better and better at this over time, and it just goes to show that not all hope is lost when you're diagnosed with this. Just look at Montel. So you see, watch her left hand here, and sometimes it is completely numb. So one technique, she's gotten faster at pulling them out. One technique we use is pretending your hand is a crane, like in a video game or at the arcade when you play that crane where it goes and grabs and picks things up, and try to win the prizes. Or in some kind of game, you sort of have to imagine like where the crane arm would be and go off of that. So that's one of the things that helps us get through this, because she can't feel her hand. It's like a phantom hand. She just sees it. So she has to imagine exactly how to use it, how to grab things. And I help out a little bit. I move the pins around just to separate them. It's a lot harder for her to grab them when they're close together, and she has to grab certain ends. Makes it easier for her. But it seems like a relatively simple task, but you see how much she can struggle from this. And again, just like the hand gestures, this is such a challenge for her, as if you got done squatting 500 pounds for 5 reps. You're going to be a little tired. You're going to want to have a seat. You may lay down. You're exhausted. You're out of breath. That's how she gets just from this game. So we have to train at home, and we sort of have to work with what we got. We've gotten certain pieces of equipment to help with our training, the piano, the pin game, and you'll see other pieces of equipment. Her half wall serves as a great handle just to help with her squats. She uses her arms a little bit, obviously. But the point is to get the blood flowing into those legs, and now to work on standing. And slowly we've gotten to the point where she can reach her hand up.
Switch hands.
And it's about almost learning how to stand again.
Try both.
And in all the things you do subconsciously, there she is,
Up,
both
up.
hands, leaning
All right,
forward.
That's good, that's good.
That alone will take her out for the rest of the day. That's how exhausting that could be for her.
Tight abs.
But as I was saying, standing in itself, you don't think about it. Your body sort of just does it on its own, but it's tight. You're tightening your core, your glutes, your chest is up, your shoulders are back. You're keeping a good posture. You're putting the weight in your legs. That's all stuff that we do without even thinking about it. She has to put a lot of thought into that because, again, the brain is trying to communicate that message, but it's having a really hard time. So we try to stay as straight up as we can. Again, sitting, it kills the low back, so standing as much as possible, lengthening our hip flexors. Sometimes she doesn't want to do something. She'll just shake her head and yell no. But yeah, lengthening those muscles is key. Here she is, just not exactly upright, working on it, and see again how exhausting that is. So she progressed over time, getting better, a lot straighter here, and getting taller, almost there, and again she almost passes out. We've gotten to stand for an entire minute. 30 seconds used to be really tough for us, but an entire minute now. Here she is, relatively straight.
Keep going.
And
15 seconds.
Getting straight is one thing, but we also try to train in correcting, like having her, go from bent over to straight without using her arms. And so she has no hands here. Just engage in that core, trying to stay balanced.
Come on. Need to readjust?
Hips
against that wall right now. All right, tall. Remove one.
No, it's not my hips, it's my tummy.
Yeah. Just as long as you're touching it. Okay, so one hand. Just bring those hips forward and squeeze your glutes. All right, keep that hand down. Next hand. All right, get tall. Get taller. Go! Come on!
Just let me.
You're not touching the wall, are you?
No.
Oh, get taller. Shoulders back, chest up. Come on. Glutes forward. Hips forward. Come on. Can you raise a hand? Oh! Put it. Switch. Oh my God. Okay.
No, let me try to straighten out.
You want to try and straighten out? All right. Push. Come on. You got it.
These are videos from over 2 years, 3 years of training. Like I said, sometimes she has the same outfit. Those are her quote-unquote gym clothes. She doesn't exactly have Nike or Under Armour products. Something that's comfortable for her. And some of these are in the summer. Even if we're sometimes we'll train outside or in the garage or on the porch.
Keep going.
Here we are, just sort of activating our glutes and our core as much as we can. That is how she can do a glute kickbacks for those of you who perform that exercise.
Come on.
This is the only version that she's able to do at this point. But this is in the summertime, and you see she's quite bundled up. That's another thing with MS is you have trouble regulating temperature. You could go out and it's 90 degrees and you don't feel it, or vice versa, and then come back inside and then it hits you. Here we are trying to get first push-up in a long time, and it's a girl push-up. It's on the knees, but I think we'll give her a pass on this one.
Get all the way up there. Come on. Lock him out.
I can.
That was good. You got another one.
No, I don't have another.
Oh, you do. Come on.
No, I don't.
All right, go down.
Nice. One push-up for her is like 50 push-ups for anyone else.
Come on. There you go. Come on. Pull with this leg. Push with that leg. Come on. There you go.
We use the elevator to go downstairs and ride the bike. This recumbent bike has helped her so much, and these are things that's sitting around in the house, just dusted the cobwebs off. So we'll do timed intervals. We'll do a max set and see how far she can go, then break it up into maybe 30 seconds. And I'll assist her on these. And we started off, and I'm doing 90% of the work. Because again, riding a bike it seems it's more complicated than you think. You have to push and pull. So we get the blood flowing, just to get that movement down. And from time to time, I'll let go.
Breathe, keep pushing, come on.
Test her strength, see if she can go on her own. But even if I'm doing 90% of the work,
And then relax.
she still will get exhausted from just, that's what the disease does. And you can't reiterate that enough of how tough it is. Something simple as that for riding the bike for a minute is exhausting, as you can see.
I didn't think exercise made you sleepy.
Huh.
I know it makes you tired.
We have to lift that and slide the chair back up.
Okay.
Push one with your legs. Keep going, keep going, keep going. Come
And
on.
as you can see, we slowly progress to where she's able to pedal on her own. It's
Come
not
on.
pretty, it's not fast, but it's a step forward in the right direction.
Pardon my French, Irene. Holy shit. Awesome. Come on, come on, come on, come on. Push.
She does have to use her
beat you.
hands
All
from
right,
time to time,
All right. There you go, there you go.
just to assist her and
Lean
get
back,
the
lean
ball
back. You're
rolling.
stronger leaning
Nothing
back.
wrong with that. Just anything we could do to progress. Okay, so
Come on.
now there was a time when if she
There
went
you
for
go, there you
10
go, there you go.
seconds on her own without any help, it was a big deal.
You got it.
But now
15
she's up
seconds
to a minute on average,
Keep breathing.
and
Nice.
you can see how tough it is, how much focus it
Keep going,
takes.
keep
But
going. Breathe.
she's obviously doing a great job here.
There you go. Use a little help. It's all right. Come on. Breathe. Let's go. Come on. You got it. Keep going. Keep going. Keep going. There you go. Come on. 40 seconds down. Come on. You got a minute. Come on. Keep going. Keep breathing. Push. Come on. Keep going. Keep going. Keep going. Keep going. Come on. Push. Yeah. That's a minute right there. You can take your breather if you want.
Here are our parallel bars, which her old physical therapist threw out one day, and she found that out and let me know because we'd been searching for a pair and couldn't pass it up. I had to go pull the pieces out of a dumpster and then put them together. Dumpster dived. I mean, you could take the kid out of the ghetto, but you can't take the ghetto out of the kid, I guess. And obviously, anything to help our training. Now she's able to move pretty fast and pretty upright. And we put a chair at each end, just in case you might need to take a break. These are only 10 feet long, so she walks 20 feet altogether. If we had a longer pair, that'd be great. The transitions and the turns is what is the exhausting part. But going from standing to the bike to the parallel bars, she got pretty damn good at that.
Taller first.
Tall.
Go. Right there. Big step. That's it. That's it. Oh, wow. Tall.
So here's another tool we added to our repertoire. Stairs.
leg up,
She
come on.
has stairs in her house, but they
Come
don't
on,
have
get up there.
railings
Yep.
on
Good,
each
good,
side.
good. Good. Now you can adjust your hands.
And this is
Okay.
the
Come
first
on.
time we were using them.
Push. Push.
You
Get
gotta
up.
imagine that, like, yes,
Come
it's
on.
hard. She's gotten
Get that leg
stronger.
up.
She's
Get that knee
lost
up. Come on,
weight.
come on.
But also think about just coordination-wise,
No,
if you
come
haven't
on.
really walked
go down.
upstairs in 20 years, how difficult it's going to be. And these ones, her left side, of course, is the hardest side, so she gets that right foot up
We'll get him fixed.
as best as she can. But she's able to come down too with her left with control. So we were really focused on staying upright and straight. 'Cause the more you bend over,
Taller, squeeze your
the more
glutes.
strength you're going to lose.
Okay, that's good. Tight abs. Get your
And
hands
as you can
back
see,
more.
let's get her up that first
And
step.
now lift one foot up, push the other foot down. Oh,
Pushing through
nice.
the handles. We got to get some new handles or some
All
new
right.
railings because
Up,
those
up,
aren't
Come on, come on,
comfy.
come on. Come on.
And adjust
Nice.
each time
All right, stand up tall. Stand up tall.
so she doesn't get too
breather
exhausted
there.
because obviously this isn't,
Oh, come on.
This is
Yes.
pretty
yes.
precarious.
All right, relax there. Take a breather.
to be walking upstairs when you're used to being in a wheelchair. So she got up 2 steps and
Yep.
I think this is here going up all three.
Yeah, I will. You
So
can just come right down.
go ahead, check that out, guys. Hope you
Nice.
enjoy this
Push that foot
video.
right through the step.
That's Irene.
Up, 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 high knee, high knee with that.
You know,
Good.
if you have MS, it doesn't mean that you can't still progress in things.
Come on.
Or with any disease for that matter,
Nice.
Parkinson's, whatever it may be, where
Stand up
your
tall
motor
here.
functions
Okay,
aren't
hands
really
are
what
good.
everyone else's are.
There we go.
This right here, being able to climb these stairs, it just
Push
proves
right
that.
through it.
So
Nice.
thanks for
Come
watching,
on,
guys.
Come on.
And
Good. Stand up
I'll
tall,
talk
tall,
to you next
tall.
time.
Tight stomach, tight abs.